Vibrant Living is brought to you by Springwater Insurance Group, teaching you how to buy the best Medicare and supplemental plans for your needs, and Aging and Adult Care of Central Washington, enhancing a person's ability to maintain a life of independence and choice.
My name is Bill Lansborough, and we've been playing ping pong at Senior Center for, my goodness, 7 years at least. I've been playing 7, and I know it's been going on longer than that. And it's just a lot of fun. We laugh more at ping pong than you laugh anywhere else in life. I mean, everybody makes mistakes, and everybody makes great plays, and it's just really fun to see seniors, especially seniors, having fun. I played a lot when I was younger, like most people here. They played a lot and then nothing for many years. And then all of a sudden, we're back together and you get refreshed and you play real well. The senior center was forced to close down, and Dave says it'll be just a couple of weeks. And boom, it just went nuts. And we haven't played since March, and now we're in October. And we're getting it back together, and we're just really having fun. It's fellowship, it's competition, it's physical activity that seniors don't get a lot of. It's something we can do as a senior that we can't play baseball anymore, we can't play basketball, racquetball, even some pickleball we can't play, but we can play ping pong. Just look around at the people. I mean, we've been sitting home, locked up in your house. You can't do anything, you can't socialize, you can't go out into public without being afraid, compromising conditions. Some of the people are compromised. And to be able to come here and play this is just like nothing else. I mean, there's nowhere else that people can do this.
My name is Sharon Lansborough, and I've played ping pong probably since I was either 6 or 5. I can't remember, it was so long ago. Well, I was always small for my age, so I could play ping pong and I couldn't play baseball because I couldn't throw the ball. And I went to a real small school and nobody wanted me on their team, so I played ping pong. Well, I need exercise. I just love sports, and we've been locked out, so ping pong is great. Well, that's where I met my current husband, Bill Lansborough. The only sad thing is he does beat me in ping pong a lot, but I beat him in rummy cube and bridge. I would just say stay active. Ping pong is really a social sport, and you can do it really late in life, just like you can pickleball. And I'm gonna start playing pickleball too. Well, it's just a wonderful sport. You can do it with like one person. I used to play all the time with my son, and I would give him a handicap and play as hard as I could. And of course, he became a very good ping pong player.
My name is Mary Ginneman, and I'm 94. I've been playing about over 10 years. Just since I joined the senior center, I started. Before that, I played when my son was in high school a little bit, and that was back in the 60s. So it had been a long time between the 60s and up in the 1900s, yeah. I like the camaraderie of the people that I play with, and I just like the game. Well, I haven't been able to visit my children. My son lives in Florida, and the other daughter's over on the coast, and the other one's in Arizona, so we can't visit. But I put a pretty nice garden in, vegetable garden. So I've been growing tomatoes and beets, and going walking and playing table tennis, and doing a lot of reading and doing puzzles. Keeping busy and feeding the birds and the squirrels that are in my yard. Lots of squirrels. I've had fun with them.
Well, my name is Marion Christensen, and I have played ping pong since I was in high school, off and on, with interlude of volleyball involvement in basketball. People I play ping pong with are my friends, and it's just a necessity versus isolation is a killer. Our group is really encouraging to people who would call themselves out of shape. I think it's even a game that can be learned by total beginners, and especially someone who has drive, competition in their DNA.
My name is Frida Johnston, and my friend Lee, she introduced me to the senior center, and I really, really like it. And I did a lot of the dances, refreshments for the dances, and Marlene and I did all the decorating for holidays and the table settings. And what else did I do? Oh, ping pong. I don't know, about 6-7 years, and I really enjoy it. I'm not very good at it yet, but I'll try. How's that? It's a fellowship I like more than the playing. I really miss the senior center and then the fellowship we had there. I go with Mary Ann. We used to have the Bible study at the senior center. I hope that you can do that again. And Mary Ann introduced me to that Bible study, and I met a lot of friends there. So it's just a fun fellowship that I think all of us need at our age.
My name is Sue Rogers. I've been playing ping pong here at the center for at least a couple years now. Well, it keeps me active, gets my heart moving, and it's a lot of fun. Just great fellowship with real sweet people. We're just kind to each other and respectful to each other, and we're just here to have a good time. Well, I've been trying real hard to stay inside as much as possible, even though I would rather not. But this is a great, safe environment. It's a great way to play a game with a team and get some exercise and still stay safe. We wear masks if we need to, but this is a game where we can stay far enough apart where we're safe. I'm just real thankful to the Lord that He has provided the senior center for so many folks in this valley, and there's a big percentage of seniors in this valley. Gives them a place to share fellowship, share their lives together, to have lunches together and stay healthy, and it's just real uplifting. I'm real thankful for the senior center and all the people who run it, like Dave.
Hi, I'm Shauna Pringle, and I'm the Assistant Regional Long-Term Care Ombudsman here at Aging and Adult Care of Central Washington. The Long-Term Care Ombudsman program is a federally mandated. Every state in the nation has the program. The Ombuds program serves individuals residing in long-term care. We are resident rights advocates for folks living in nursing homes, assisted living facilities, and adult family homes. Our region serves Adams, Chelan, Douglas, Grant, Lincoln, and Okanogan counties. We are always free and confidential. Due to COVID, many freedoms have been restricted to protect the vulnerable from infection. Mandates and policies are ever changing. These are challenging times for all, but especially those residents living in isolation from family and friends. To understand more about resident rights, compassionate care visits, essential support visitors, please contact the regional program by dialing 509-886-0700. Ask for the Long-Term Care Ombuds.
Hello, my name is Gerald Dickinson. I'm a board member of the Wenatchee Valley Senior Activity Center, and welcome to another edition of Vibrant Living. Today, we have the opportunity to have two very well-known, I didn't want to start to say old friends, but I don't want to say you guys aren't old enough yet. that we've had a relationship with you and the Senior Center for some time. And I'd like to introduce Erin Cass and Lynette Geringer. And welcome back home. It looks a little different here today, you know, with there's not much activity going on in the Activity Center right now because of the COVID-19 situation. And we've all been affected by that, of course. But it's a pleasure to see both of you in person and again. And Erin, I feel like, you know, I've known you now for years. We've had the opportunity to work together and know each other for some time. You have a new business that you're starting out. It's called
Healthy Aging LLC.
LLC, yeah, okay. And I'd like to know a little bit more about that today because when I've known you in the past, you started, I think you were the executive director of Wellness Place. And as I recall, you did that for about 6 years or so. And then for the last year or so, you've kind of gone out on your own and doing other healthy aging stuff. And Erin and I had the opportunity to do a program called the Aging Mastery Program back in, I believe, February and the first part of March of this year.
Seems like a long time ago, doesn't it?
Well, it was. And then we got shut down, you know, immediately after that. So it's great to see you again. And both of you, thank you for everything you've contributed to the Senior Center over the years. But today we're also going to be talking a little bit, or primarily, about a program that you have coming on television on North Central Washington Life station. And you're hoping that it'll start off here maybe sometime later this month. And it's regarding the SAIL program, is that correct?
Right. The SAIL program is a very well-known, popular, evidence-based program that's here, all over the state of Washington, but focusing on North Central Washington, there are, just in the Wenatchee Valley alone, there's well over 21 classes, fitness classes led by volunteer instructors. And, you know, since March, they haven't been able to meet. You know, 600 to 700 people in our valley have known and loved these programs. Lynette is an instructor as well.
Now, as I recall, aren't you both master certified instructors or something like that? Tell us, Lynette, tell me a little bit about that. What has to happen for you to attain that certification?
So you have to instruct a SAIL class, you have to take the instructor training and then instruct for at least a year and have some background in healthy aging, healthy exercise for the senior population. And then you go through master trainer training and you're monitored in how you're instructing classes, and you're monitored on the knowledge of aging physiology, all of those kind of criteria that need to be met. And then if you're lucky enough, you pass. You pass the certification process. And so that means that with a master trainer certification, that means that both Erin and I are certified to then train SAIL instructors.
Great. And now, Erin, I believe you have a fairly new role in the state. Is that correct, that you're sort of responsible for the whole eastern Washington part of the state?
Well, I have a contract with Department of Health to help deliver evidence-based programs into our areas, rural and Wenatchee, all over. Those programs are SAIL, Stay Active and Independent for Life, A Matter of Balance, and also I'm working with the Aging Mastery Program with you, with the Senior Activity Center. So my contract is just to come up with creative ways during this pandemic to still deliver these services, in which the program that we're starting on NCWLIFE will be incredibly helpful because people can turn on, you know, Channel 12 or live stream it and access this great class led by Lynette and volunteers in their homes. So that's our mission, is to continue working really hard on trying to keep people moving, engaged, you know, interacting with others in whatever way we can deliver that. So.
Great. Yeah, and I love the name, or the, you know, SAIL, Stay Active and Independent for Life. Isn't that a grand goal, you know, for all of us?
Right, we know people are really missing each other. You know, people within the SAIL classes are longing for that interaction. We know it's tough. Sure. It's really, really hard, and we recognize that. We're still trying to come up with ways where people can still be healthy within their homes, find outlets for that.
Lynette, you have been working here at the Senior Center for a number of years. Can you tell us a little bit about the history and what was SAIL, how was SAIL involved with the Senior Activity Center in the past?
So originally back in 2007, I was injury prevention coordinator for North Central Emergency Care Council. So that meant that I was involved at the state level in trying to implement new programs, especially the SAIL program to prevent falls. Falls are the leading cause of death and disability in our population 65 and older. So Washington State developed this program. It was put together by orthopedic nurse. She has her master's in nursing, as well as University of Washington professor of physical therapy, our master's social worker at this Washington State, and they developed a program that was safe and effective for our senior population. They studied it, and within a year of those focus groups and studying, they found a reduction in falls, in fall risk. So then that meant that we were a proven practice that soon went to the National Council on Aging, and we were continuing to show evidence of falls prevention with those balance strength and flexibility exercises. So it became a Tier 3D evidence-based program, which means it meets all the criteria for administration on aging at the federal level, that it's safe and effective for our seniors.
So it's thrived in our valley for 13 years.
Yeah,
thanks to you bringing it here.
So with that, we brought it in, and actually my mom and a group of her friends were the first people to attend a SAIL class at the Senior Center. Senior Center was the first place that we were able to offer a SAIL class right here. Yeah.
In this room, kind of.
My mom still, when SAIL class was being offered, Mom and her friends were still attending that SAIL class.
Hi, I'm Jim Heinlein, independent agent and owner here at Springwater Insurance Group, and we help people all throughout North Central Washington at our offices to understand Medicare, make plan decisions, and so you all know that right now we're in the annual election period where you have until December 7th to decide what do you want to do for next year, for 2021, and your Medicare plan. So many of you don't know, though, that Medicare has another time period that you can make changes in. Yes, by December 7th. If you want your coverage to begin January 1st, make a decision by December 7th. But once your plan begins in January, did you know that you have 3 more months to change your mind on your coverage and make another decision? Most of you don't know that. And at Springwater Insurance, we want to teach you all your choices. So if you get into January and February and March and you realize that your coverage is not suitable, we can help you make one more change. So give us a call at Springwater Insurance Group. We can help you for a January effective date, as well as help you in that new open enrollment period.
Hello, I'm Dave Tosh, Executive Director, Wenatchee Valley Senior Activity Center, and today I'm with Dr. Kjobech, who is a longtime Valley resident and practiced here in the Valley for a number of years. He's also the founder and longtime chairman of the board of Wellness Place. I think a lot of folks in the community are aware of Wellness Place, and I'd kind of like to introduce him with some of the things that he's been involved with the community, primarily Wellness Place, and just speak a little bit about what the organization has done for the community.
My turn?
Yeah.
Okay. Well, Wellness Place was started in 2003, March of 2003, and it's been in about 4 or 5 different homes, but now is currently up near Colonial Vista, Prestige, the Prestige organization up there, and it is primarily set up to help people who have malignancies and to help their family of the people who are having malignancies. And our help is basic. We want people to come in the door if they have needs, and we'll try somewhat to help them understand what's going on, but that's mainly their doctor's business. But then food, clothing, wigs, mammograms, or rather breast models and things like that are all provided. And I mean, we send people to Seattle when they need to see other specialists and have helped pay for some of that as well if they're in. As a matter of fact, if somebody has a need and they come in to talk to us, we'll find a way to help.
Apparently, Carl Campbell has had a lot of influence and assisted greatly with Wellness Place. Of course, Carl has just recently passed on. He's also had a big influence here at the Senior Center. You want to just say a few words about what Carl was able to do for your organization?
Well, it's not just our organization, as you've mentioned, but I just want to say he's one of the really quality people who came to this community, developed a large business himself, and never forgot where he is from, nor forgot to help the people from his area. We had been in one of his buildings with Wellness Place, but for some reason or another we left and went into another place that was not nearly as satisfactory. And one day I was out riding my bike and I got a phone call from my wife that I needed to go to see Mr. Campbell right away. And so he determined that the building that we had been using was really he thought should be used by Wellness Place. And so he sold it to us for, a relative pittance, but I think is wise in saying to the organization, if you're really serious, you need to be paying something to make it real.
I know that I, over the time that I've been here, have worked with a lot of nonprofits, and I think it's important for us here to do that because our senior membership is involved in a lot of different activities and organizations.
Sure. Yeah.
I know that you have a major fundraiser every year.
That's right.
And I think there's one coming up here.
Well, it happened. Because of COVID, like everything else, ours was virtual, and we made almost as much money this year as we did with a much more involved live event last year. And of course, that's all of it is due to Julie, our chief, who is running the organization now. She's just super. Lindholm, Julie Lindholm.
Yeah, I know that we went to a gala several years ago, and I think it was a Roaring Twenties theme or something like that with a big band down at Pybus after Pybus had just opened up, and it was a great event. And I know that when I looked out in the audience, I recognized about half the faces were people that I knew from here, and I just think that's a neat thing that within the community. What really makes the community great is all this interaction among organizations.
And I'm in this room, and it's so sad that I'm in this room because it's so quiet. And normally when I'd come in here, there are people having coffee, including me, if I drank coffee, down there at the end. And there are people exercising over here, and there are people crocheting here and talking to one another. And there are 150 people in this room, and now we can't do that all. So we're just digging, trying to figure out how to fill those holes. I think it's obvious it's a threat. There have been the statistics change, but there have been thousands and thousands of deaths from it, and I think it's something we all have to think about and listen to, and I think we have to listen to the people who have facts and do some of the things that they suggest. It's so early in what is, let's face it, it's a new disease. It's not even a year old. How can everybody know everything about it? How can everybody know the best way to take care of people? But I really think it's tough for people, particularly people who are just stuck in their own apartment. And I know a couple of them that don't do anything. And they need to have some people they can talk to, get them on the phone,